AI-assisted healthcare is the wave of the future. AI is awesome because it's going to improve patient safety so much with so many different things and reduce medical error and reduce kind of wait times and mistakes and all these things. But you still, at the end of the day, need somebody to practice the art of medicine, which is look at the person in front of them and not the algorithm that AI is just using. But you have to have somebody willing to do it. I'm a big fan of it in general, but if you want to have care that's still driven by a human being virtually through telehealth, there are a couple of things we need patients to start doing consistently to stop driving people away. So there's two main problems I see as somebody who sees a lot of virtual patients. So the first one is when you show up saying, I only need this. This is what I have and I only need this. Now, you could very much be right, but we need you to go through the whole process with us. And I'm a firm believer in patients know their body better than anyone else. But also, there have been times where people have come to me saying that, and it turned out to be something completely different. And if we had tried what the patient came thinking, they could have wound up dead. Again, I'm not saying don't advocate for your care, but it should be part of a conversation about what's going on with your symptoms rather than anything else. The next part is the assumption that everything that you're thinking that you have can be treated virtually. I'd say the vast majority of things I see in urgent care or mental health or anything else in primary care can be treated virtually, but there are definitely some things that cannot be. And when patients come with certain symptoms, I have to have them go see somebody for their safety. I get that this is frustrating, and I get that you've just paid for a service and now have to go pay for another. But if it wasn't for that person doing the telehealth visit, you may have not known that what you needed required you to go out and do something about it. And in a lot of cases, if you don't go out and do something about it, something bad could happen to you, and you would have never known. So in most cases, then demanding a refund, despite the fact that you used the service for what it was designed to be used for, which is to evaluate you, assess you, and figure out what your treatment plan is, not necessarily provide all parts of it, is kind of not cool. And the other biggest problem is making the assumption that if you are messaging somebody who does virtual care to get scheduled, that you're going to get scheduled like that moment or the next day. Because contrary to popular belief, I do not spend my entire day sitting around waiting for you personally to message me saying I need to be seen. And I promise you, nobody is more upset that you can't be worked in quickly besides you than the person who's trying to get you seen. Because I will tell you, I will spend the next half hour of my life trying to reschedule things I need to try to work you in. But sometimes for so many reasons, it just can't happen. So what do these things have in common? So basically, these things come down to the fact that this is not dissimilar from a doctor or a nurse practitioner or someone having a practice in person. They're still bound by standards of care guidelines, and they're still bound by time and scheduling. The beauty is you're not having to waste tons of time going to them all the time. And even in the cases where you need care right away, we usually try to do our best to help you get directed care wherever you're going. And sometimes that may not be completely possible, but we'll make sure that you are armed with as much information as possible to get the next step done. So how is this contributing to providers not wanting to work this way anymore? It's patients coming at us when we have to have those kinds of conversations. When I say to somebody, I'm so sorry, can you explain your symptoms to me so we can have a conversation about this? And you get angry that I won't just prescribe you X, Y, or Z. Or I say, I'm so sorry, I'm really concerned about you. I need you to go to urgent care or the ER. And you get angry at me because I won't just give you what you thought you needed. Or I say, I'm so sorry, I don't have room in my schedule. I'll put you on a cancellation list, but let's get you scheduled in 2 weeks for X, Y, and Z. Because it doesn't feel good to try to care for people that way. I want to be really clear too. Part of my reason to talk about this like this is because I don't think patients realize these things, because how could you? How could you realize that this is not how these things are designed to work if nobody's explained it? So now let me ask you this. What are things you think providers can improve in terms of access to virtual care and things like that? Drop me a comment below and follow for more.